Yeah, so what I would say low vision is vision that's not good enough to do what you want to do. Can you still read comfortably or at all? Can you recognize people? Can you watch TV and enjoy it? You know, a lot of why I do what I do is because it can make a huge difference for people.
I worked at State Services for the Blind in the Mankato office, and I worked there for 42 years. And I've always enjoyed writing stories. I've always enjoyed traveling. I've been to Israel and to England.
I love computers and technology. I am currently a professor in the computer science program at Minnesota State University Mankato. But I'm also a musician. I play piano and guitar, and I, once in a while, if I'm coaxed enough, I will even sing.
In low vision restoration, I help people that can't see well for any number of reasons, and that's with macular degeneration. There's two types of that, wet and dry. Some Stargardt's disease, optic neuritis, tumors, strokes, almost anything that could cause a person to lose their vision to a point that they can't function. It's really what is a problem for you. And then, all right, what can we do to try to help you see well enough to do that?
I'm not legally blind, but I am visually impaired. I have some diabetic retinopathy.
I have albinism, which is where my hair color comes from, and my light skin. Very severe nearsightedness, and photophobia, which is a sensitivity to light.
I don't do a normal eye exam. I don't do eye drops, none of that. I'm there to help a person see better using some customized telescopic devices in general that magnify. The only way we can get anybody to see better than they already do is to make things look bigger, closer, easier to see, which is magnification. We use binoculars essentially or telescopes that are built into glasses that you can wear. So they can be made to help read, to see up close, to see across the room, to drive or enjoy the scenery, whatever the task may be. So this is called a bioptic telescope. So like a bifocal, there's two parts, or there's a top and a bottom. The top in this case has the bioptic, or has the telescope of whatever magnification we want.
The bioptics work really well for near vision, for reading small print. So I'll use it for that, or like if I'm crocheting, because it's nice that you get your hands free with the bioptics.
I have to be very close to read, computer screens, phones, whatever. I have to be maybe 2 to 3 inches away from it. So the bioptics allow me to sit at a more normal, standard distance. So I just look down, at the laptop, rather than having to scrunch my back and squeeze my stomach. And for somebody like me, where basically my work and my hobbies are computers and technology, it's a big deal.
My husband was legally blind from birth. It was like a life-changing event for him when he got his bioptics. It was so exciting the first time he sent me like a Valentine's card, and he actually wrote in the card, like, I love you, and that's the first time I'd ever got anything written by him.
So at Low Vision Restoration, we offer what's called a free phone consultation. But what we do is have 10, 15-minute conversation, basically an interview of the patient, so they know what to expect with costs. We're trying to find out, do we think we can help them? Is it worthwhile to come in and do an appointment and evaluation for the glasses that we use?
Dr. Palmer is not going to do anything medically with your eyes. It's not like going to your ophthalmologist. This is strictly devices that might help you be able to read or see in the distance, and it's worth a try.
It's definitely worth your time to, at the very least, go visit with Dr. Palmer and see what he's able to offer you.
You can go from not being able to do things, or being dependent on everybody else and maybe shut down and anxious and depressed and so on, and give them the opportunity to live a fuller life.